Broadcasting from Nairobi 94.4 to the world in www.spicefm.co.ke. Also to the world via social media handles SpiceFMKE on Facebook, YouTube, and Twitter. Now let's go to other parts of the world, to Rome in Italy specifically, and we speak to Marco. Good morning, Marco.
Good morning, guys. How are you?
We're
Very
fine,
well,
thank you.
Good
Morning.
Morning, everybody.
Welcome to the Situation Room, and thank you very much for speaking to us this morning.
You're welcome. Guys.
Marco, you know Kenya very well. You've lived in Nairobi, you have worked in Nairobi, and now you're back home in Rome, Italy, where we are seeing the number of cases rising on a daily basis, the number of deaths rising on a daily basis. Italy is basically the center of the world news currently. How is it for you on the ground?
The situation is actually a little bit improving in the last 3 days. When I say improving, it means that we have low cases, new cases, and we have less people dying. Even yesterday we had over 600 people died. So the situation is like, the science say it's a little bit better, but, the numbers are not good at all.
Yeah.
So
Marco,
that is the situation at the moment.
right, that's the situation, Marco. And we know that if you look at the beginning of how things kind of exploded, and that a number of people, moved around, and that's how the virus moved essentially. Are we seeing a difference now? I mean, yes, with a lot of people dying, are we seeing a difference now in how people carry themselves with the lockdown in several cities?
Yeah, everybody has been locked here, imagine from 11th of March. We thought that from Wuhan, it would not arrive here. Or at least it would be like a flu. Many people, they say, oh, it's a flu, don't worry, there is nothing to be worried about. So we have 17,000 people died here.
Wow.
So the situation in Nairobi, in Africa, could be better and could be worse. They are talking about the weather. They're talking about if it's too hot, the virus usually doesn't travel as much as in the cold weather.
Yeah.
So we have to see, because nobody has a cure at the moment, and the cure will come out in 1 year. Even though people they say we have a vaccine, we have chloroquine, we have HIV medication that they can help. Yes, everything can help, maybe. But there is no vaccine before 1 year. That is for sure.
Right.
And maybe one thing. Tell me.
Marco, in February and early March, the people in Italy were basically having a laissez-faire attitude, saying, well, this thing cannot reach us, or even if it comes, there's going to be like a common flu, we can deal with it.
Yes.
Was that the attitude with the government as well?
The government, in 1 day they say, guys, it's a flu, don't worry. Then it's dangerous. And then after 3 days, everybody goes out and drink. There is no problem. So, the problem is politicians, they give you very funny messages at the time.
Right.
So you just have to be precautious at the moment and just try and be careful about your gut feeling. Yeah. So you try to avoid everything. What is happening here at the moment is that nobody talks to each other. Even when you pass close to each other, you don't talk because you're scared.
Wow. Wow. When people are looking back at how they were behaving before the lockdown and before the cases started rising, do you feel, are people feeling that some sort of regret that I wish we knew, had we known, we'd have done better?
Definitely yes, because with all these people, we lost a generation, or we are losing a generation. You have to consider that Italy is the second country in the world with elders.
Yes.
Yeah. Now, we lost most of them. Let's say 80%, 70% are old people. So your grandparents, your auntie, that is bad. The difference with Africa, your population is much younger. So you might have that upper hand in which, they are not old. Because people that are dying, they have some pathologies, like diabetes, like cholesterol, like asthma. So that's where the virus attacks first, people that they have a problem. Having a young population, it could be a big help for Kenya and Africa in a whole. But it's still attacking everybody. It doesn't look at if you're young. In England, one kid of 5 years old died. In France, a 17 years old girl died. So it depends how he attacks you. And there is no mercy. Trust me, there is no mercy. The only thing we have here in Europe at the moment, a good health system. So they can pick you up and they put you on the machines. They have all the technology possible. What is worrying me, and you know better than me, is that Kenya has maybe few facilities.
Yes.
And people, they don't go to the hospital and say, oh, we have a flu, whatever, because they're also scared, because the hospital is the main place where you get sick.
Yeah, I mean, talking about the health, talking about the health system, Marco, I mean, just from the pictures that we saw in media, was that the situation that, medical workers were overwhelmed with the numbers? They couldn't really hack it. Has that improved? And also then seeing that some doctors and medical staff were pulled out of retirement to come and help out. In addition to that there just wasn't enough space. Has that changed now?
But, the government decided to make an announcement looking for doctors and nurses, and we got a response for 10,000 new doctors, even though we got doctors from Russia, China, Cuba. Some people, they came also from Egypt.
Yeah.
So everybody's chipping in, like Qatar, UAE. The problem is that at the beginning, because of this mixed information from the government, so many doctors, they were not wearing masks.
Oh.
They were not wearing gear. We had today 95 doctors died because of that.
Today alone?
Today, no, in the whole.
In total, okay, to date, right.
To date, yeah. To date, 95 doctors and nurses die because of not proper gears. And we are a developed country, so imagine what an information or misinformation can do.
Indeed.
So your people, your nurses, your medical staff, they have to be very careful because they will get it. And actually, the main virus, or the virus actually sits in the hospital, because you cannot sanitize the hospital every single day. So imagine what is happening there. You go inside that you have a headache, you come out with the virus. So you have to be very careful.
Marco, paint for us a picture of how this system is working. You've got a hospital and you've got people who need to be tested, or people who are presenting themselves with the symptoms. What is happening? How do you take yourself to the hospital? How do you get tested, and how do you get admitted into isolation all the way to ICU facility, even in the unfortunate event of the 17,000 who've died? Just paint for us that picture of how it's all happening.
Okay, the symptoms are you feel tired. So if you want to test yourself, try to do 3 or 4 staircases. If you have a little bit of fever over 37.5, if you start coughing, and if you have pain on your joints, these are the signs that you have something wrong. So what is happening here, you call the medical guard, you don't call the hospital anymore, there are certain numbers that you call only them, and you will tell them the symptoms. If they will tell you to stay home and monitor, they will take your number and they will keep on calling you 2-3 times a day to see how you perform. If the temperature goes up, they say 38, 39, most of the time they come, they take the test, they see exactly if you're positive or negative. If you're positive and you have not very high symptoms, they prefer you to stay in isolation at home. Because the hospital, they are really full of people, especially people that they are in need.
Right.
Only when the situation is becoming worse, and when I say worse, is your oxygen level goes down. So it means that, you cannot breathe properly. We have a level which is 99, 98. When it goes to 80, 85, that's the moment that you have to go hospitalized immediately. Because you're not able to breathe.
So they come and pick you and take you to the hospital?
They come and take you in ICU, and then it depends which system they want to use to give you the ventilation, which is the oxygen. Forced or through the normal oxygen cylinder. So it depends on the person.
So these medical nurses that you call as the first line of people that you are speaking to, are they in a call center? Are they decentralized? Is it per
It's
town?
a call center. It's a call center from the civil protection in Italy. You call them, they have your number, they call you every day, they want to know exactly, they monitor you. So in order that they know exactly what is happening. And one thing I would like to tell you that maybe has not been discussed yet in Kenya, whatever. Life will change for everybody.
How so?
will not be the same.
How?
To you. Here, when it will open, you cannot go to the bar, to the club like before. You
Yeah.
have to keep a meter or 2 meter distance.
Yeah.
Will not be able to group together anymore. And this situation, it will not change until we find a vaccine, which means we are stuck in certain places. We cannot go and mingle together anymore. And this will be for a year.
That is
it's
so. Right
bad.
now, you are under proper lockdown, a full lockdown in Rome and the
We
whole
are
of
locked
Italy.
down. We are locked down. Yeah, we are locked down. And actually, yesterday they put another 15 days more because of the high rate of death.
All right.
So
So
we are locked down.
how do
until
people
the
get their
4th of May.
how do people get their provisions?
We get the chance to go and buy provisions, but we are monitored, which means you can buy provision only near to your place. You have a supermarket, you have to go to that one. If they found you that you go on, for example, I don't know, you live in Lavington and you want to go and buy in Westland,
Yep.
they pick you up, they give you a fine.
Oh, really? Okay.
Oh, you're fined.
You're fined.
And how
They
do
give
they,
you
how do
something like,
how do they know
50,000 fine.
you've ventured far from where you live?
Because they do here we have in our ID exactly the road where you live, the place where you live. So when they see on the ID, oh, you live in Lavington, what are you doing in, I don't know, let's say Westland or South B?
Yeah.
You have no excuses, so they give you a fine.
Yeah. Because you can
That
get
is
what
the
you
only way.
need. If it's essential services, you
Exactly.
need like food or medicine, you can get it in your neighborhood. There's no need for you to be somewhere else.
Exactly. That is the best way they're doing here in order to stop you to roam around like the way you want. And if you're not able to go out, they will come, the Red Cross, to deliver food. Or the supermarket, you do this, pick and pay service. You order and they bring it to you. So they want people to stay home because more you go out, more you get it. And remember, it doesn't matter only for you to sneeze or cough. Only talking to each other, there are these small drops. If you do it, when you talk near to your phone, you will see the drops on your phone, which means when we are talking to people close range, they will get it, this kind of small drops. So it doesn't matter if you're coughing or not. You will get it as much as closer you are to the people. So you have to limit that one.
Marco, if I may ask, how exactly is Italy dealing with a vulnerable population, people who are economically challenged and are not able to afford food?
Now, we have a big issue here. The problem is that 90% of the population is not working. Only few people are working just to keep, this provisions, like the supply of provision for the supermarkets going on, and the delivery trucks, like UPS, DHL, all these people, they are working, because without them, we will be completely stuck. But the problem is people are running out of money. Now, the government here, they decide to give 600 euro, which is about 70,000 Kenyan shilling, to the people who need the money in order to support them. Because the same thing will happen to Kenya. So many mamantiliyas, so many people working outside, making 100 bob a day. Now that everything is locked up, who is going to take care of them?
Yeah.
People will die or starve. People, they start robbing. Here it happens in a couple of cases that people, they were waiting outside the supermarket, and they rob the old people with the food, because people, they need to eat. Now the government has to be behind and say, guys, okay, we give you 1,000 shilling for all the people that they need it. Enroll yourself, show me that you don't have a job, we give you money. Otherwise, these things is going to last, guys. It's not that, when you finish the cases, because what is happening in Italy at the moment, we're already thinking that the second, how can I call it?
Second wave.
The second, exactly, is coming in September, October.
Wow.
So that's why, actually, yesterday, all the schools have been postponed until September. We're supposed to go back next week until middle of June. Now they close everything.
Until
September, there is no school, and actually, September. And actually, in September, they will consider if they do start working. Because, you cannot hold kids in school far away, and you cannot put a mask on the kids. And that is very important also there. Kids, they are the first one, they can get it between themselves. But fortunately enough, they don't get it so badly like us. But they can pass it to the parents.
In terms of
So
helping, in terms of helping people by the government, how long is this likely to hold? Have they said that there will be, help from the government for the duration of this period?
Yes.
Okay.
Exactly. Every month they will revise it, and every month they're giving money to the people. The people that here the system is a little bit different, but they know exactly through a document, you prepare a
They
document.
know who is where and who needs what, yeah.
Exactly.
Okay.
But this has to be worldwide. Everybody has to be helped because we are stuck. We are not moving.
Wow, it sounds like a tough one. We wish you all the best, Marco, in Rome.
Thank you, guys. Thank you, guys, for
You
calling
will
me.
overcome this. We are at that point where we are now starting to, get the point that it's coming, it's here. And the message that you've given us, of course, will go a long way in convincing those who are listening to us that this is not a joke.
Let me tell you, guys, stay home. It's harder. We human beings, we want to be out.
Yeah.
But it's scary because the symptoms are bad, and when you are in ICU, you don't breathe. You cannot breathe. Actually, the patients here, they make them sleep. They put them to sleep. And when you go to sleep, you don't know if you wake up.
Wow. There's a message to ring home, if any. Thanks, Marco, for that information.
You're welcome, guys. You're
Asante
welcome.
sana.
Cheers.
All the
Thank you,
best for you.
Marco.
Ciao.
Bye-bye.